Hi, good day. My name is Choo. My metric number is 2548223. Today I'm going to present about the research tool. My topic is modeling the impact of lockdown on COVID-19 infection using system dynamic approach. So let us see the introduction. Okay, background of the study. First, we know that in the first wave begin on 24th January, and the second wave of 27th February, and the third wave is 20 September. So, and government was implement the MCO on 18 March 2020, followed by CMCO and RMCO. So problem statement is citizen has been enough sick at home to do such thing like financial. They have financial problems, social lifestyle, and type of workload, and everything required to get in online. But certain places does not have good internet, so they has trouble with the internet connections, and this will be make their profit go down. So that is research question. Research question got three. What is the factor affecting lockdown on COVID-19 infected? And second is how to develop the framework concept. The third one is the solution to solve the reduce the COVID-19 infection. So research objectives. The main of research is to develop a dynamic model on the impact of lockdown on COVID-19 infections in Malaysia. Below are the sub-objectives for the research. First is to identify the factor of the affecting lockdown on COVID-19 infection. And the second is to develop the concept of a framework on the relationship among the factor of affecting lockdown on COVID-19 affected. And the third is to identify the solutions to reduce the COVID-19 infected cases. And the scope of the research is this study is focused on the MCO the faced by the Malaysians during the pandemic COVID-19, and all activity needs to move to online mode. For example, the business previously needs to commercial cooperate through the face-to-face exchange the item, but now everything just put in the online and delivery to people. And this is the significance of the study. Okay, COVID-19 pandemic is the challenge for our daily life, so this research important to how to get back normal lifestyle before COVID-19 pandemic. So literature review. Okay, according to WHO, on 15 November, the current outbreak was 63 million people infected and killing by more than 1.4 million people in more than 200 country. So there's got five factor that influence COVID-19 infected cases. Okay, New York stated that the most discriminatory considerations are the population growth, research statistic, and report airport flow combined by highest age classes above 40 and especially 60 above. Um, Significantly relate to better air quality because there is no airline, there is no transportation on the roads, and get better. Okay, citizen to use a mask as a precaution path. Use regular hand sanitizer, glove, and a mask of medical base. 1% of infections affects agents, no ears that research possibility affect affecting the global economy. Okay, monitoring approach applied on the study related to the impact of the COVID-19 is the method used is system dynamic. Most people using SIR and SEIR model and PDS network model. Okay. Second is discrete event simulation. Okay. The third one is mathematical model. Fourth is cross-sectional online survey. The fifth is the descriptive analysis. So conclusion we can make that influence of the COVID-19 infection that causes force citizens to use face mask, hand sanitizer, and a lot of medical waste. So there has is also had badly affected global economy. It's suitable to use system dynamic to by using SEIR model to reduce the COVID-19 infection cases. So methodology. So the system dynamic is look like a framework for the relationship rather than the things, but not to see the patterns for the changes rather than a static. So systems thinking is a discipline that look at the structure that make up complex situation and distinct the high relations from the lower level changes. System dynamic methodology, dataset. So dataset daily. So we are assembly from the world matter and the novel coronavirus visual dashboard for the amount of suspend infection, uh, recover and dead patients in the country worldwide. Daily data have been released from Malaysia by the Star newspaper, Malaysia Kini, and the Ministry of the Health of Malaysia. So there is got six price of price for method. So the first one is identify the problem. Second is make the model and with SEIR model. And third is the collect the data daily COVID-19 cases, how many cases infected and so on. And fourth is put the data and write it, and we estimate the 3 months. Okay, and fifth is performance evaluations, like we test by validity, structurability, and behaviorability. And okay, so the stage is we make the intervention and give the scenario and evaluate the performance changes. So research framework. So this the research framework, and this is a simple model development. So first is the problem identify the aim of the system dynamic model on the impact of the lockdown COVID-19 infection in Malaysia and identify some problem solution that could be implemented to reduce the time. And we using the formula dynamic hypothesis feedback system in reinforcing and balancing loop, CLD diagram, and stock and flow diagram. And this model will be run for the next 300 days from 20 September 2020 to 17th July 2021. So the model development got there is two. First is CLD diagram, and the second is the stock and flow diagram, the baseline. Okay, so we saw the baseline separate three population, SEIR model, and lockdown model. So okay, we after that we test the structural validity and it will show successful unit check model is okay. So behavior validity, we compare the real data and the forecasting that we estimate. The data is exactly almost the same. Okay, So for the result for intervention one, for first implement the lockdown from 0 to 1. So we can see that the current situation is the red one, and the green one is the behavior validity, the real data. And we can see that after we in the intervention one, the infected cases will be lower and will be zero after that. It's good for us, and we can get the normal lifestyle again. So the second intervention is reducing the people going out the rate from 0.75 to 0.23. So we can see that the current graph is green, and the red one is the intervention one, and the blue one is the intervention two. That's reduce people going out 75% to 23%. After we know that after MCO that people can't going out, right? So the percentage of people going out will be reducing. Okay. So conclusion, the aim of this model is to reduce the COVID-19 cases. So we implement the MCO to stop the transmission. And the second one, the model consists of population, SEIR model, and MCO. And the model was stated by structural validity and behavioral validity. Okay, the fourth is the two intervention was showing the infected COVID-19 cases will be down. So so for overall communication, maybe we can improve more about the model so that it can be like exactly the same with the real data. Okay, that's all for me. Thank you. Thank you very much.